A very good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr. Mamta Tapas ma'am from Parul University. So the today's topic will be exploring Ranunculaceae family in managing female disorders. And over to you, Ashika.
Hello. Hello.
Ashika.
Yeah. Good evening to everyone. So, this is a webinar series organized by All India Homeopathic Student and Youth Association. And today's topic of this live webinar is exploring Ranunculaceae family in managing female disorders. And our guest speaker is Dr. Mamta Tapas. She is Professor Homeopathic Materia Medica at Parul University and Research from Gujarat. And we are waiting to hear from you, ma'am.
Thank you, Ashika. Over to you, ma'am. Mamta ma'am.
Yes. Good evening to all. And first of all, I'm thankful to all the members of Aisha family that again they are inviting me as a guest speaker. So let us start our topic. Am I audible, ma'am?
Absolutely, ma'am. Absolutely, ma'am.
Am I audible?
Yes, ma'am. Yes, ma'am.
Okay. Done. Thanks. So we are today we are discussing about the Ranunculaceae family first. So how the Ranunculaceae family drugs are helped to managing the female disorders. So before starting our topic, just I introduce this topic first. In this topic, we firstly, what is our major motto for this group of drugs are there. First of all, we know that most of the Materia Medica drugs are based on the plant kingdom, and this is one of the important family from the Materia Medica that cover so many drugs are there. And second point, as our Materia Medica is based on the plant kingdom, mostly herbal Materia Medica, we know that ancient time is also herbal Materia Medica is there. So if we know the common characteristics of each family, so we can understood how that family under family which drugs are there, so we can manage with this drug commonly, and we can use in the practice also. So if we know the some themes or just gist from the each and every group or the family, so under that family which drugs are there, so we individualize that drug and we can prescribe. So it may cut short the way of prescription. So though it is only academician or for the examination purpose is not there, so it clinically it also helps to study the various groups and the families, so we can understood the clinical point of view also. So first of all, what is Ranunculaceae family? That Ranunculaceae family we consider first introduction of the Ranunculaceae family, then we go the general characteristics from mental as well as physical from the Ranunculaceae family. Then we are focusing our main topic, the female disorders. So first of all, what is the Ranunculaceae family? Is the other name is buttercup family also. These are the yellow shiny. These are the some drugs. They are from the Ranunculaceae. Ranunculaceae family is mostly poisonous when it is in the crude form, and they are the members which belong to Ranunculaceae family are mostly narcotic, and they are poisonous one. The examples are like aconite that contains the aconitine as a active principle, and this is the poisonous. And that contain aconitine only. Aconite is not only Aconite napellus, Aconite lycotinum is also there, Aconitum ferox is also there, and it is much more poisonous to carnivorous animals than to the herbivorous. And it is also as an arrow poison, and that comes from the leaf. And the other medicine is that Helleborus foetidus. It is also narcotic poisoning, and it may cause the convulsions, and it may be the death may occur as a poisonous. Pulsatilla is the fresh plant, has a bitter and acrid taste, and chewed causes burning in the throat and the tongue. So generally, the ranunculae are the family members are generally irritant to skin and producing inflammation and vesication as a poison. But when we proved it as a after potentization, that becomes miraculous effects in the our Materia Medica. And the important drugs that we study under the Ranunculaceae family are from the aconite group, like Acotinum camerum, Acotinum ferox, Acotinum lycotonum, aconite nap, Actia racemosa, Actia spicata, Adonis vondalis, Equilegia vulgaris, Caltha pastoris, Clematis erecta, Helleborus foetidus, Helleborus niger, Helleborus orientalis, Helleborus viridis, Hepatica, Hydrostis can, Peonia officinalis, Pulsatilla nigricans, Pulsatilla nutania, Ranunculus acris, Ranunculus bulbosus, Ranunculus pecaria, Ranunculus framula, Ranunculus glacialis, and Staphysagrina. So these are some important drugs that falls under the Ranunculaceae family. Now, generally, Ranunculaceae family are having the most action is on the nervous system, then the mental, mind, and female genital organs. This is the main sphere of Ranunculaceae drug, and also the mammary gland is also one of the important. Then generally, when we see the mental and physical characteristics both through the Ranunculaceae family. So first we are seeing the mentals of Ranunculaceae family. Generally, Ranunculaceae family drugs are very hypersensitive to all external impressions. For example, aconite to music, noise, Clematis to touch, Pulsatilla to heat and noise, Ranunculus bulbosus to touch, Staphysagrina rudeness to touch, punishment from or violence from or sexual abuse from. So they are sensitive. Then they are also having the anger. Violent anger is there in this. Generally, Ranunculaceae family having the mixed emotions. So generally, you all know the human emotions like angriness, violentness, then the sensitiveness. So all together, mixed emotions you are getting from the Ranunculaceae. Ranunculaceae family having the violent anger and elements of the anger, especially aconite, Pulsatilla, and Staphysagrina. Elements from anger, generally aconite, Actia racemosa, Pulsatilla, Staphysagrina. Anger vexation from generally from long continued mental trauma, like for example, the history of grief is there, or history of any mortification is there, or history of any insult is there. Then the medicines like aconite, Actia racemosa, ranunculus, and Staphysagrina are there. Absent-mindedness is also present, like aconite is there, Clematis, Helleborus, Hydrostis, Ranunculus spicata are some medicines where you got the absent-minded or the weakness of memory you got. Aversion to company, where you also got the Actia racemosa, Clematis, Helleborus, Pulsatilla. But they are, though there is a aversion to company, but they are ameliorated when alone, especially Helleborus and Staphysagrina. But Staphysagrina is only in the Ranuncular family where they desire company, both desire as well as aversion. Generally, in the Ranunculaceae family, we got that aversion to company is there, but only the Staphysagrina is the drug where you got the company aversion and company desire both. Then we go on to the, these are some characteristics mental we are seeing. And now the physical symptoms, like most of the Ranunculaceae group of drugs are chilly in nature. They are right-sided medicines. Sora is the prominent meism, dominating meism in all Ranunculaceae. Sometimes the Sora and psychotic is seen in the Pulsatilla and Ranunculuses. And Hydrostis can and Staphysagrina cover all three meisms like Sora, syphilis, and psychosis. So meismatic dominance is through the Sora generally. When we come towards the dreams, there are dreams also find amorous dream, vivid dreams are there from aconite, Pulsatilla. Amorous dreams with pollution like Pulsatilla. Dreams of animal generally from Hydrostis, Pulsatilla, Staphysagrina. Frightful dreams we are getting from Ranunculaceae like aconite. We know that frightful dream, patient wakes with the fright dreams. We are getting it from Actia racemosa like Semisibuga, Helleborus, Hydrostis, Pulsatilla, Ranunculus bulbosus, Actia spicata, Staphysagrina. Dreams of snakes we are getting from Ranunculuses. Generally, Ranunculus, all species of Ranunculus, we are getting the dreams of snake commonly. Generally, as we are seeing the physical general symptoms, so perspiration is there on single part or one-sided part. On one sided, we are getting either right, either left. Generally, all the Ranunculaceae family group of drugs are right-sided. So we are getting the symptoms one-sided from aconite pulsatilla. Single parts में aconite helleborus pulsatilla is there. In the lower part of the body, ranunculus bulbosus, perspiration is unilaterally from pulsatilla. Upper part of the body contains aconite and pulsatilla, and part which on lid, that is the pulsatilla is there. Clinically, many of the Ranunculaceae families are anti-cancerous. So, for example, Caltha posteris is a very effective medicine in the treatment of uterine cancer. Clematis is also given in the cancer of breast and uterus. Hydrostis also in the given the cancer of stomach. Actias paccata is also one of the important medicine that is given in the cancer of stomach. But these are the clinically proved. Actias paccata is one of the important medicine that we know that it is the most important medicine for the rheumatism purpose. Only we know the Actias paccata for the rheumatism of the small joint, especially wrist rheumatism. But clinically, it may be helpful in the cases of cancer of stomach also. Hydrostis is a very good medicine from Materia Medica where we got the cancer of stomach. And clinically, it is also given in the books of Materia Medica, many there where the cancer of stomach is there. CA service is also another important clinical aspect of hydrostis scan. So CA cervix, cervical erosion, that is also given. So these are some clinically. Some medicines are very clinically are there. They are having the anticonvulsant also there, like aconite helleborus, ranunculus, staphysagra. Convulsion after anger in staphysagra is the good medicine. And general modalities from Ranunculaceae family, generally aggravation from motion is there. Finding the medicines like aconite, simisbuga, helleborus, pulsatilla, ranunculus, staphysagra. General aggravation evening and night from aconite, simisbuga, or the Actia racemosa, clematis, pulsatilla, ranunculus, and staphysagra. Tendency to cold take easily, that is chilly, is aconite, pulsatilla, staphysagra. Emaciation rather than obesity seen in clematis, hydrostis, pulsatilla, and staphysagra. So from this view, we know that the commonest medicine from the Ranunculaceae family that we use in the clinically in practice are staphysagra, pulsatilla nigricans, aconite napalus, hydrostis can, ranunculus bulbosus. These are the frequently used medicine from the Ranunculaceae family for various purpose, various clinical conditions. But when we go through the repertoire point of view, so some rubrics are also there key that belongs to the Ranunculaceae family. Generally, the rubrics found under the repertoire are elements after indignation, elements from mortification, humiliation, chagrin, emotional or mental, elements from anger, vexation, grief with silent, anger, irascibility, tendency, trembling with, respiration difficult, mortification after. So what is that the mortification? That means sadness or anger, or these are some rubrics. If you go through the repertoire and if you search these rubrics, so we get the Ranunculaceae family drugs under that rubrics. So if we find repertorially, repertorization totality, so we got this Ranunculaceae families. This is some rubrics that we belong to aconite napalus. If we see the some rubrics from aconite, so under the rubric of aconite, we get that mind, elements from fright or fear, accident from sight of an accident, old, fright, fear, suppressed, general elements from fright or fear, generalities from generalities, we get the sleeplessness from fear, fright, or anxiety. In nervous system, trembling, mental condition, fright from, or generalities, elements from grief, sorrow, care. Then female menses suppressed after fever, after fear, fright. That is also important rubrics from aconite napalus. If we go through pulsatilla, some rubrics are there like elements from grief, anger, fright, palpitation, trembling of limbs from chagrin, fright, or joy. See, these rubrics are taken only that is belonging to the Ranunculaceae family, not for the particular drug. But these drugs are come under Ranunculaceae family. So few examples are given for these medicines that are frequently used in the clinical. So I am giving some rubric example from repertoire, not whole rubrics are given. only that denoting the Ranunculaceae family whole common characteristic that belongs to a particular that medicine we are considered here only. They say, for example, Ranuncular bulbosus, we have following rubrics like generalities, excitable, complaint from fright or vexation, generalities, limbs, trembling, chagrin. From Sapientia, we got the following rubrics like general elements from fear, fright, grief, mortification, especially caused by offense. Any offense if caused, then there is a some rubrics are there. What are the common themes of Ranunculaceae family that we see in the repertorial totality? We know that chagrin, mortification, vexation, indignation, and the physical or the somatic effect of these emotions are there. But this in family, not only anger and vexation, but there is also grief and fright seen in all the remedies. Just we see the rubrics, we know that all in rubrics are given that elements after anger, elements after fear, elements after fright is given. So when we look all together, we see that the vital sensitivity of Ranunculaceae is an extreme sensitivity to mortification, vexation, chagrin, indignation, and insult that give rise to anger, and especially these emotions give physical effects, particularly on the nervous system. So generally, whenever we while case taking, if we find this kind of rubrics or this kind of words of like fear, if any suppressed fear is there, fright is there, vexation is there, chagrin is there, mortification is there, and that affects both physical as well as mental affection in the patient, then we can think about the Ranunculaceae family drugs, and we definitely got the result in this case. So that is the motto ki we are studying these type of groups. So Ranunculaceae is one of the plant kingdom group. Already we also taken the webinar on the Kali group as well as Ophidia group. So ultimatum ki what we are just if we know the themes of each and every family, so our way of perception is comes very short time we can give the snapshot prescribing in the clinical practice. If we got the any what we say कि अगर कोई धागा हमें मिल जाता है while taking our case, so we can give that ki we if we know that that belongs to one particular group or one particular family, so we can think about under according to other totality, according to other symptoms, we can think of only that drugs that come under that particular group or a particular family. So that is one of the most important objective to study the any family or group. So these are the most important theme of Ranunculaceae family. If you got it while your clinical session, like just fear, fright, mortification, chagrin, vexation, and indignation. Then another word is important for Ranunculaceae family is the trifles. Trifle means a very small thing. So they were sensitive to very small things. In Staphylococcus, Dr. Phatak writes that morbidly sensitive, the listing hurts or offends. We also see the excitability of the nerves remains for quite some time after exciting cause. Feeling mental or physical continue for some time after the event. So there are the common remedies of the Ranunculaceae family. These are the common to the remedies of Ranunculaceae family. See, trifles. Trifles means a very small thing that matters to lot for a Ranunculaceae family drug. Slightest matters offend them. That is also one of the key symptom or the key note symptom of Ranunculaceae family drugs. And that keynote symptom is just stick to mostly the Staphylococcus, but also other medicines rather than apart from Staphylococcus, other medicines are also comes under these trifles that this affects the most of the symptoms. So trifle is the also one of the keyword to select the Ranunculaceae family trifles. So generally, Ranunculaceae family, we are having the normal emotions are there: grief, anger, sadness. So these are some emotions. We know that human emotions are there, but only the Ranunculaceae family is there. Ki we find all these three emotions at the same time coming. They are intermingled with each other, that creating a internal conflict, and they express at the physical level and give rise to many bodily symptoms is there. So it is one of the family that contains the mixed emotions. So you know that we are also normally the human beings are having the same emotions at the same time. Sometimes he got angry, he got sometimes very this he got something मतलब उसको कभी गुस्सा आता है, कभी इरिटेबल बन जाता है, कभी ग्रीफ होता है, सैडनेस हो जाता है. सो we know that, but these are all emotions are mixed in the Ranunculaceae family drug. So this is also one of the characteristics that belongs to the Ranunculaceae family. So rather than going for physical symptom most, because nowadays also psychosomatic disorders are increasing, so you must know the that any changes in human emotions or human behavior or the patient behavior, you can, if you just know what is the behind that, that we also known as the life space. When while case taking, why we are giving the importance to life space while the case taking, that is the one of the important feature ki we can, if we know the mental cause or elements from, then we just give the medicine very short time and perfect simillimum we can choose from the that our case taking, if we are perfect in dragging the symptoms from the patient, especially related to that mental. So the Ranunculaceae family is the only family that we are giving the mixed emotions or mixed the mixed mental symptoms we are getting, and after that, due to that mixed emotions, insulting or angriness or grief or fear, fright, that may the medicine is there and we give the. Then another is there ki so these are some important symptoms from overall Ranunculaceae family. Now, when we are considering the females in given, because we know that the pulsatilla is the great female medicine. We know that pulsatilla is the good female medicine from Materia. All of you know very well that, and all are using the pulsatilla frequently in your clinical practice also, no doubt. So pulsatilla is a main important medicine that come under the Ranunculaceae family. You know that the pulsatilla is one of the medicine that having the vine flower is a common name, and it is pulsatilla is the medicine that we are given from, especially when we are talking about the female. It is a predominantly female medicine, and that falls under the Ranunculaceae family. So when we are considering the female disorders, so pulsatilla may it comes in the list where we got the number one medicine, because so many are using frequently the pulsatilla in the clinical practice. Along with that, we know that other medicines are also there, like Natromose, Sepia, Calcarea, Lycopodium, Thuja, Sepia, Platina. These are also some medicines. They are belonging to the predominantly used in the female conditions. But the Ranunculaceae drugs, mostly the drugs like pulsatilla, Simisviga or Actia racemosa, Hydrestis, Staphysagrilla. These are the drugs which are falls under the Ranunculaceae family. They are mostly used in the clinical practice in managing the female disorders. Now, first of all, we know that there is a female having the different emotions along with their journey is there from puberty to menopause, or from womb to tomb. We are using the word that is from puberty to menopause. Some many females are got the many complaints during the these, because of the current lifestyle disorders like lack of exercise, sleep, changes of diet towards the fast food is increasing. The lack of exercise is there. Mental stress are there. Emotions, suppressed emotions are. So they are all commonly find, and that all are generally used as a in the females. So if we are having the knowledge of that, so we can use this medicine effectively in our practice. So generally female disorders, we know that it is very, very important to maintain the female health. If the female is healthy in the family, then the whole family is healthy. So, and the journey of the female is from puberty to menopause is very important, because most of the disorders are found in this age group, puberty to menopause. Generally, if we categorize the female disorders from puberty to menopause, so at the puberty, we know that the infection is more, hormonal changes, hormonal imbalance are there. So most of the girls are suffering from the clinically, we are seeing that premenstrual syndrome, then the vaginitis, that is the infections are there, leukorrhea is there, and so many Materia Medica are having these such symptoms like their puberty. Then we are considered when the female is going to the reproductive age group. So there are also some menstrual disorders are like the menorrhagia is there, metrorrhagia is there, PCOS is there. Then during pregnancy, the minor elements, major elements during pregnancy is there. Along at the labor is also there important, where at the time of delivery, after delivery also some important is there key. At that time you can use the, then when approaching to menopause, the menopausal depression or the menopausal hot flushes or mood swings or mood changes or some minor elements at the menopause, because all these are physiological process. But in this physiological process, if there any mental trauma is there, mentally that not feel, that time this females are suffering so many outbursts are there, outbursts at the mental as well as physical level. So if the homeopathy is the best to the females, where all the journey of female is a very safe, with a low with no complications, with no any the serious disorders. Along with that, we can use the homeopathic medicine. So minor elements as well as major elements during the whole journey of the female, we are just giving with the homeopathy. So how the Ranunculaceae family drugs are important in the first, we know that Pulsatilla is the most important medicine, where we know that ki Pulsatilla is the medicine where we got from puberty to menopause. It is effective on it at each and every age group. The Pulsatilla is indicated. Pulsatilla is a good medicine for the amenorrhea, for the menstrual disorders, dysmenorrhea. Pulsatilla is also given at the labor. Pulsatilla is given in the, for abortion also. Pulsatilla is given in at the reproductive age group in the leukorrhea, that is vaginitis. So the symptoms we are getting that, you know, that the Pulsatilla is constitutionally very delicate, mild ladies where we got a weeping disposition. Then Pulsatilla is having the consolation, ameliorates the complaint. We know that. So where we got the Pulsatilla at puberty, generally amenorrhea, that is absence of menses, suppressed menses from getting fit weight, from nervous debility or chlorosis. Chlorosis means anemic condition. Tardy menses, too late, scanty, thick, dark, clotted. Changeability is the main indication of Pulsatilla, where we got the changeability of symptoms like intermittent flow. Then along with that, chilliness, nausea, downward pressure, painful. Intermittent flow is there. Flow is scanty or profuse, or flow is stop and again start. Then intermittent flow is also there. If we are talking about the leukorrhea, it is acrid, burning, creamy, pain in back and tired feeling. Diarrhea during or after menses is seen in the Pulsatilla. Then Pulsatilla is generally indicated in the puberty, where we got the mild gentle girls with low spirited. Diarrhea during menses, leukorrhea, thick like, creamish leukorrhea is there. Frequent low chill discharge where the flow like milk or corrosion burning. Principally at period, before menses, during menses or after menses we are seeing. And sometime with the cutting pain is there, aggravated when lying down with swollen vulva. Then during the Pulsatilla, during pregnancy is there, where we got the after pains in the female of mild disposition. False pregnancy, During pregnancy, nausea, morning sickness, varicose veins during pregnancy. If is there, we can treat the pulsatilla during pregnancy. If there is a varicose veins are there, then this medicine is very useful, pulsatilla. But only that the pulsatilla is not given in the early months of pregnancy. During the pregnancy, if we know that there is a lameness in the pelvic region which is aggravated from weight, so changes position frequently, then it is also indicated in the threatened abortion where flow is ceasing and again returning. Then during labor, intense inertia weeps because she is not delivered. Patient having the weeping because the labor is not obstructed labor is there, mall position of fetus की वजह से अगर is there, postpartum hemorrhage के लिए important medicine is there. Pulsatilla is also there, convulsions following sluggish or irregular pain of labors, lochia, scanty, milky or suppressed with puerperal fever after delivery, phlegmasia, dolens, labor pains 2 weeks, spasmodic and seizing is there. So at that time the pulsatilla is indicated during pregnancy also. Then pulsatilla is given in the breast complaints also where we got the swelling of breast, tensive pain as if the milk rush into them and cause pressure while nursing, lump on breast of girls before puberty or escape of thin milk like fluid, scanty supply of milk is there. Affection of nipples, whips every time child is put to breast, pain extends into chest, neck, down, back, changes from place to place. So whenever at the time of lactation, if the pain, due to pain, the weeping is there in the females where you got that pain, especially changeability of pain and pain is running to chest, neck or down back. Milk suddenly suppressed, lochia becomes milky and white. Galactorrhea, especially in females who do not trust their children after weaning, breast swell. So pulsatilla is also given in the galactorrhea after the weaning. If there is a swelling of the breast is also there, so pulsatilla is indicated. So you know that pulsatilla is indicated in every symptom of the females from puberty, during pregnancy also, after pregnancy also, this is indicated. Now next medicine is come under the Actia racemosa is there. That is also known as Simsifuga. So it is also indicated in the amenorrhea. Pain in the ovarian region shoots upward and downward in the anterior surface of thighs. Pain immediately before menses. Menses generally profuse, dark, coagulated, offensive with backache, nervousness, irregular and ovarian neuralgia. Pain is across pelvis from hip to hip. Pain is there. After pain with great sensitiveness and intolerable to pain, inframammary pain is there worse on the left side and facial blemishes in young women. This medicine is also where melasma or hyperpigmentation on the face, the Actia racemosa is indicated. So this is a very good medicine where we got the Actia racemosa is also medicine for the dysmenorrhea. Then ovarian neuralgia, amenorrhea, it is also covered by the Actia racemosa. Again, Actia racemosa, it is written in the Boski. It is if there is a frequently history of abortion is there, then Actia racemosa is indicated. Along with that, Actia spicata, another medicine from this group of Ranunculaceae, both same family of Ranunculaceae, Actia spicata, where you got the rheumatism is there during pregnancy, especially small joint affection, or if we know that wrist rheumatism, where we got the pain and swelling of the joints, then the Actia spicata is indicated. Actia racemosa, another along with that mental are there also, that illusions are there, illusions like the illusion like mouse is running the chair, and illusion like the cloud is hanging over the head. That illusions are also present along with the mentals. Morose females are there, weeping tendency, sadness is there, mortification is there. So along with the common characteristics of Ranunculaceae family are also seen in the Actia racemosa. But when we are talking about only the females, so generally it is good medicine for the abortion, after effects of abortion. Then if the history of the the abortion is there, then that is also habitual abortion की history है, तब इसके बाद भी ectodermosa is indicated in the females, and also there is a blemishes in facial मतलब face sorry face pigmentation on face generally seen in the due to the hormonal imbalance, the pigmentation on the face is seen. Other medicines are also there, that sepia is also indicated in these blemishes in the young women. Then the Copiavia offensialis is another medicine also used. But when we are talking about the Ranunculaceae family drugs, so Actiaristimosa is the one of the important medicine where we got the blemishes in young women. So Actiaristimosa is indicated in the females for this condition. Then Aconite napellus is another important medicine, but it is the acute medicine where you got only the suppression of menses after sudden suppression of menses. Suddenly, if the menses are stopped, but you got the symptom like sudden fear and fright, especially in plethoric girls. Plethoric girls where we got the anemic girls, but when rising, the blood rushes towards the head, and on rising, the patient face become congested, but on lying down, the patient face is pale, and generally they are sanguine. Sorry, where you got the symptoms like dry vagina, menses too profuse with nosebleed or too protracted late frenzy on appearance of menses, suppression of menses from fright, cold, and plethoric subjects, ovaries congested and painful, sharp shooting pains in the womb. In females, after pains are very severe with great fear and restlessness. Then suppressed menses resulting from fear, fright, vexation, chilly, dry, especially suited to the young girls. Only the aconite indication, you know that the aconite other symptoms are also there, like tension is the keynote of aconite, restlessness, and fear, fright, anxiety. So if you are getting to any cause where you got the fear and fright and sudden separation of menses is there, aconite is the medicine for that. And other music is intolerable in the aconite patients, so that becomes sadness. So along with the medicine, along with the fear fright, you got the history and sudden onset, because acute onset of the fear fright affection, and if any menstrual disorder, not only amenorrhea, but if you got the cause of fear and fright, then use the aconite napellus in that case where you got the symptoms like restlessness, fear, fright, anxiety, and ambulation from open air and young plethoric girls. If you got any female symptoms, then you can use the aconite napellus in hypotension. Staphysagria is another important medicine from the where you got the cystitis in young married women, where irritable bladder in young married women is there. Parts are very sensitive. Leukorrhea with prolapse with aching around the hips. Nymphomania is there with extreme sensitiveness to mental, physical impressions. Mild is mostly dwells on the sexual subject, so sexual desire is suppressed. Then saphysagria is the medicine where any symptoms related to suppression of highly sexual desire is there. Then painful sensitiveness of genital organs, especially when sitting. Then it is also important medicine for the pruritus senilis, matlab if there is a due to dryness of vagina, itching at vagina is there at the menopause because of the decrease in the estrogen level. So if there is a pruritus senilis is there, along with the lancinating itching in vulva after coitus in newly married women, staphysagria is indicated. Sufferings from coitus is there in newly married women with itching is there, then staphysagria is indicated. Also for the ovaritis, that is inflammation of ovaries with burning and stinging pain, drawing pain is there. That is extended to the thighs. Then flow of blood from genitals, wrong aggravation. Menses had ceased for a year. Again reappeared with cutting pain, violent pain at new moon. Menses irregular late, sometimes wanting, first pale, then dark and clotted. Amenorrhea from indignation, then the staphysagria is indicated in that condition. The next remedy from Ranunculaceae is that acrid and growing leukorrhea is there, ovarian neuralgia, always excited by atmospheric changes. So ranunculus bulbosus is given when the ovarian region is sensitive to touch. Sensitiveness or ovaritis, that term we use, the ovaritis or ovarian neuralgia, then, and that is only by the atmospheric changes is you are getting, then ranunculus bulbosus is the medicine in the female. Ranunculus bulbosus, clinically, if you go through, then we know that ranunculus bulbosus is a very good medicine for the skin complaints, especially the herpes as well as other like the skin complaints like eczema. But the females, we are indicating the ranunculus bulbosus in the ovarian neuralgia that always excited or aggravated by atmospheric changes is there. Then the clematis erecta, this is another where you got this medicine for the cancer of breast, where you got the menses too early, then swelling and induration of the mammary gland is there. Then Caltha plasteris, it is a very rare medicine, but it is a clinically proved medicine where only it is given in the tincture form, single doses in the tincture form for the uterine cancer. This medicine is, the symptoms is not given for the cancer of uterus from Caltha plasteris, but it is the Cooper is the one of the physician. He used this medicine in the treatment of uterine cancer clinically in the tincture form, and this proved is very good medicine for the uterine cancer where it given the tincture form. So Caltha plasteris is another medicine from the Ranunculaceae family. So these are the important drugs that covers the female disorders mainly from puberty to menopause. So Ranunculaceae family drugs are well indicated in all types of menstrual disorders. So what are the review of the how much menstrual disorders? We know that all types of menstrual irregularities, amenorrhea, then too early too soon menses, too late menses, profuse long lasting short duration menses. So all types of the medicines we are used the Ranunculaceae family drugs, mainly Pustula, Staphysagrina, Adrestiscan, then the Ecterecymosa, Caltha plasteris, Staphysagrina. These are all important Ranunculaceae family drugs that are used especially in the female disorders right from menstruation, menarche to menopause. It is also having the prominent action on the breast, aconite lycopodium, Actia reximosa for inflammation of breast, peonia for the breast ulceration. Peonia is medicine, only we know that it is indicated for the piles or the anal fissure, but again, this medicine is also indicated in the, if there is a breast ulcers are there, then peonia is indicated. The peonia is also one of the important medicine that is given for the Ranunculaceae family. But peonia, you only know that peonia is also only indicated for the anorectal symptoms. But no, peonia from Ranunculaceae family is also indicated for the ulcers in the breast is there. Pulsatilla, we know already that it is given especially in the lump of breast on girls before puberty. That is, if there is a breast lump is there before puberty, we know that generally the lumps are not formed in the girls at puberty, but if in the pustula due to hormonal changes, if there is a precocious puberty if is there, or the early changes are there in the pustula is indicated where you got the lumps in the breast. Ranunculus is also indicated in the breast symptoms like acute pain in axilla, so severe, and the having the fear of cancer. The ranunculus is the remedy. If there is a pain in the breast and the pain in the axillary region, and the female thinks that or the fear that it may be the pain of the cancer, then ranunculus is the medicine. Clematis is also one of the important medicine for the tumor of breast. You got the tumor in the breast or the cancer of breast, the clematis is indicated. So overall, the Ranunculaceae family drugs are, if we are find that though it is not only the female, but it is also another indications are also there of the Ranunculaceae family. But when we go through the literature and when we through a thorough study of these drugs under the Ranunculaceae family, so when we go through clinically, we find that the Ranunculaceae family drugs are mostly act on the females and female disorders, and they are prominently female medicines. That's why we study the Ranunculaceae family under the female disorders, how to manage the female disorders by using the Ranunculaceae family drugs, so that whenever the patient comes to you, a female patient comes to you, so according to the cause and according to the mantles of the Ranunculaceae family, you may get the result with this using the Ranunculaceae family clinically. Okay, so this is the overall view of Ranunculaceae family and how to treat the Ranunculaceae family drugs in the females, especially all the disorders, right from menstrual disorders to menopause to pregnancy. So thank you so much for listening me, and always I am thankful to the Aisha family. They are inviting me always as a guest speaker, and hope so in the future also they are inviting me with more and more clinical subjects and exploring Materia Medica well. Thank you so much.
Thank you, ma'am. Thank you so much for the extensive, knowledgeable session. We'll be looking forward for many more, ma'am. Respected participants, now there will be a question and answer session. If you have any questions, just comment in the comment box so that ma'am will be giving the answer. Yeah. Hello, ma'am. Am I audible to you, ma'am?
Yes.
There is a question from the participant, ma'am.
Yes.
Best remedy for uterine fibroid जो आपने इस्तेमाल किए थे ना मैम आपका क्लिनिकल लाइफ पर, सो कैन यू नेम इट लाइक दैट, दे आर आस्किंग मैम. या मैम.
Okay. Is it from Ranunculaceae family? Actually, uterine fibroid is mostly we know that uterine fibroid is generally psychotic tendencies there only because we are having that fibroid, that is the tumor of uterus. So generally that psychotic tendency based medicines. So I use this Staphysagia in the uterine fibroid, and I got the result. But no, Staphysagia is covering SORA and psychotic both from Ranunculaceae. But I think other according to symptomology, again individualization and all this we are keeping in the mind, we choose the medicine. But first of all, if we go therapeutically, the way of prescription only for the uterine fibroid is different. But when we are taking case as a whole and patient as a whole, and when we are taking the life space of the patient and we are giving the medicine, so definitely that way of approaching patient is different and the medicine will be different. So there are the two way when we are focusing on what exactly. So according to me, uterine fibroid, if we go therapeutically, the medicines are very different. So like psychotic tendency medicines are there, calculate carb is there. If you're in the acute condition, thalassemia bursa is there, trillium pendulum is there, sabina is there, thuja is there, calculate floor is there, calculate carb is there. So many medicines are coming in the list of the uterine fibroid. But when we are taking the case as a whole, and if we are getting that patient life space and all these things, if we are considering, and if we goes the root of the cause, and if you are getting some theme from that, then the medicine is different as a constitutional, and definitely we get the result in that conditions also. Yes.
Thank you, ma'am. Any other questions from the participants? So they can put it in the comment box. Ma'am, myself, I have a question, ma'am. So for the selection of the remedy and all, how we can like to depending upon the disease, what are the major investigations we can also prefer for the, especially for the female disorders, ma'am?
Investigations means what point of view we are telling? Matlab, if
So
we are taking a
especially
symptom,
uterine problems, ma'am.
okay, again, the criteria for selection or going for investigations, again, it depends on the many other factors also. Age of the females is generally whether the female is married or unmarried. Let's say, for example, age of the patient is before marriage is there, so we go for the USG first. Generally, PCOS is excluding. If the marriage is there and history, it depends. Repeated abortion history is there or any history of the pregnancy, multiple pregnancies are there. So overall, on the basis of history taking, we are having some plan of treatment, plan of action should be there before going for any management or any treatment plan. We just go through plus age of the patient first of all, and what are complaints are there. मतलब पेशेंट कौन सी कंप्लेंट लेके हमारे पास आ रहा है उसको भी ध्यान में रखते हुए we can suggest the females the investigation. Generally, the commonest investigation we are suggesting to the patient is USG. Okay. First, we are doing the clinical examination, and generally, we will not find any during the clinical examination. So, you must go for the investigation. And basic investigation, we are suggesting the in the cases of female because hormonal assay is another there, but hormonal assay it is also again that we are to refer to the endocrinologist, and it is very cost effective also there. So, commonly, we are suggesting the females. Generally, USG we are suggesting the females. So we can rule out on the basis of USG, then we can go further for the further investigations. But again, we have to correlate with again with the clinical symptoms of that patient, so that we can suggest a plan. So it depends again. It depends on the patient comes to you with what the complaint, age of the patient, and what exactly patient comes to you for what. मतलब wherever he comes with the pain, where we comes with the menstrual complaints, मतलब menstrual any scanty menses है, too long duration menses है, menses early आते हैं या फिर leukorrhea है, then according to that we go for the investigations and we go for the other investigations.
Thank you so much, ma'am, for the extensive explanation. Any other questions from the participant? Okay, ma'am. I hope they have all cleared the questions, ma'am. So thank you so much, ma'am. Thank you so much, participants, and thank you all. So there will be a small announcement over here. So the sessions till now, the completed sessions pertaining to the certificates, it will be issued to a registered mail ID soon, as soon as possible. We our team are working for it, so you'll get the your register the people, see the participants who have registered will get the certificates, so they should register definitely in the Google form. So hope you understand that you should registration should be done for the certificate. And So that is the criteria to get the certificate. So thank you all. Thank you so much, ma'am, for enlightening us with your knowledge. Thank you, ma'am.
Thank
Thank
you.
you all the participants.